And we're pleased about this because we have now demonstrated to the federal government that we have a vision statement for this hospital for excellent care, for improving staffing, for improving safety, both for patients and for employees here at this hospital. It has happened because of the leadership of Cheryl Strange, our new CEO. It has happened because we have had a new management from top to bottom associated with this hospital. And it's happened because we are insistent on high quality care for the people who are in this hospital. And our drive to do this is not just for compliance with federal rules. It's a drive to make sure that these people have a chance to realize a new future with mental health that we believe is possible if we provide excellent care. So there's quite a number of things that are in this system improvement agreement. It involves an assessment that is now literally going on as we speak to come up with a correction plan that soon will be agreed to as well. So we're very happy about this development. It means that the federal government will continue to invest in our state, and we're happy about that investment, and it shows this bottom line. Western State Hospital is on track for the improvements that Washington State expects, and we're going to get them. With that, I'd like Cheryl to make a few comments, and we'll stand for questions.
Thank you, Governor. This is indeed a big moment for our hospital, and we truly thank the Governor's office, the legislature, the Secretary of DSHS, and the Behavioral Health Administration for securing the much-needed funds to restore the hospital so that we can move forward in attending to the treatment needs of the almost 900 patients here at Western State Hospital. My management team stands ready and able to assume this responsibility. I have made several changes to our leadership structure and will continue to do so in order to assure that the right people are in the right job to accomplish this. We have a long way to go. The Systems Improvement Agreement is by no means a free pass here. The federal government will maintain its regulatory authority to end this agreement at any time that they should find that we are not progressing and making the necessary changes. The work ahead, it will be difficult, but by no means impossible. And I believe that the answer to our success is to remember why we are here, that people with mental illness can and do recover, and that this hospital is instrumental in that effort. And in closing, I would just like to add that we look to life beyond the Systems Improvement Agreement and working with both our medical and behavioral health partners across Western Washington in creating a center of excellence. And we do this for our patients, for their families and loved ones. And we very much appreciate the media's support in this effort. So thank you.
Questions?
What kind of changes are you talking about here at the Vision State?
Sherry, you want to talk about it?
Yeah, I mean, we are focusing, sir, on getting down to the basics of quality patient care and safety. We have had multiple supports and reviews with both our current consultants as well as the Department of Corrections, and giving us tips on how we can take a hospital and create some safety and pathways. So I'm reorganizing at this point my teams to focus on those key areas of quality treatment. From a medical perspective, we have patients with co-occurring disorders, psychiatric and substance abuse. We have a lot of patients with comorbid chronic care conditions, diabetes, heart disease. So focusing on quality care in a safe environment. So everything I am doing at this point is reorganizing groups of work to get that done, bring transparency, communication, visibility, training to that effort.
In terms of safety.
Let me add something and answer your question too as well. Cheryl's the CEO. She's really jumped in this with both feet. She's getting good reviews from the people who are involved in this effort. But it is clear to me that this institution is going to need and will have additional staffing. We need people to actually fill these jobs, and we now are going to have a plan to fill those jobs. We need people on the job here at Western State Hospital. And when we get people on the job, they're going to provide quality care. So we are engaged right now in a staffing plan to fill those jobs. The legislature has helped a little bit by funding 50 jobs, but we have almost 100 that are unfilled. And we are going to find a way to fill that, and when we do, this hospital is going to be a first-rate, excellent institution. That's what we aim for. We're going to achieve it.
In terms of safety, obviously a lot of people focused on this in the last couple of months. The Associated Press said 185 escapes in a 3.5-year time frame, as I'm sure you're well aware. So how do you change that number, especially with the park across the street and the school next door?
I think there's a lot of different ways to change that, and it's not going to be one fix. There are a multitude of things. We have to look at patient movement. How are patients moving through the hospital? There are many ways they do that. I think we need to look at how we might create more predictable pathways for that. We have to really focus on our notification and how we process and escalate when a patient leaves the hospital. And patients leave hospitals under a lot of conditions. The escape, for example. But people leave unauthorized leave. People walk away. And so we're working very closely with the Lakewood Police Department and the Steilacoom Police Department to understand their needs, redesign that notification system so that we are clear which one of those categories a particular patient falls within.
But what changes today?
The changes today is on Tuesday. I have reorganized my leadership team to include a chief of security. And that gentleman will start on Tuesday. He has demonstrated experience in that. We will centralize key control. We will look at everything that we can do to make it a more predictable environment. It ranges from a line of sight and how dealing with blind corners. So there's capital issues, there's training issues, recognizing something before it happens, intervening when we know that our patients sometimes have issues that require intervention. So I want to leave it at that. I'm going to leave it to the expert who's going to start on Tuesday to work with his team. We'll reorganize around that so that it's all in one central. I think in a time of crisis, you centralize. And once you have sustainable systems in place, you can then begin to expand that out.
What is your message to the community that worries a suspected killer might escape again?
My message to the community is we want our patients stay safe, we want our staff safe, we want communities safe. And we will work very hard to make that happen.
Let me add something to that, if I can.
Please.
We're going to hire people so we can get this job done. We've been trying to run this hospital on the cheap with not enough people, and it's unacceptable. We need to have people who can provide security, who can guard these patients, who can do the training, who can solve the capital problems, and we're going to get that job done. And it may take some dollars, but it is time for excellent care here, and we're going to make sure that happens with safety for the community.
Governor, with all due respect, that's happened during your term. There hasn't been enough, as you say, staffing here. Why has that been the case?
Well, it actually has happened before my term. What has happened is during the recession, which was before I was elected governor, we have hollowed out this institution. In fact, we hollowed out our whole mental health care system. And since I have become governor, I have been committed to rebuilding our mental health care system. That has involved putting almost $800 million into our mental health care system. We now have 50 or 60 beds that are coming on in Maple Glen and Yakima. We've hired new crisis intervention managers. We have new systems to help young people get into emergency programs. We have integrated our chemical and our mental health delivery systems, so we have a more seamless system. What was hollowed out before I became governor is being rebuilt while I have been governor, and we are not done. As Cheryl said, this is not the end, this is the beginning. But it is good news that the federal government has shown confidence that we have a track to success. But that track will involve hiring more people. Look, the problem of this institution is if you don't have guards to guard the patient, we probably should not be surprised if we have some of these problems. And we're going to do what's necessary to get people to work here, and I believe we are going to succeed on that. And those discussions are underway right now.
Governor, without today's agreement, what would have happened? And is this just a stopgap measure?
Well, there's about a year involved in this process to completion, but we were in jeopardy of losing federal funding, and we have acted with great diligence to assure that did not happen. I want to thank the administration for working with us to look at our plans for the future, and they've been willing to do that. I want to thank them for their flexibility, if you will, in this regard. They're going to hold our feet to the fire, and that's the right thing to do. But I do want to make clear this. My motivation for doing this is not just the federal government. It's because of people who are living here, who are seeking treatment right here. This is a little bit personal. I got a friend with a son who's at this institution right now. A guy I went to law school with. I know the pain of parents who want to have their kids restored to mental health, and they can be if they get excellent care. We have confidence if we give them excellent care, they can return to their families, they can return to their jobs and their schools. We're going to give them that shot. I'm committed to that.
In terms of,
heard you talking about, we've got the big problems and all that. I heard you talking about turning concrete into grass and dingy walls into freshly painted areas. How important is that, and can that go to maybe fix some of the problems because everybody's in a little happier state?
That is an excellent question, and it is something that I feel is top priority. A person's living environment goes towards their self-esteem and their value in the world, and so to me that's front and center, right along with security enhancements. People rise to the level of that which they are expected, and so I look forward to cleaning the place up.
Governor has about one more minute.
Well, how do you address the staffing issue when it's hard to recruit people and then hard to keep them on the job?
So I have made it clear that we are going to solve this staffing problem, whatever it takes. And right now there is a comprehensive evaluation going on to figure out what that takes. I believe it's going to need some changes in compensation. And I believe when those compensation changes happen, we're going to fill some staffing shortages. We have been paying people below scale, and as long as you do that, you cannot fill your staffing shortages. That's what we call a no-brainer in this business. That's going to have to improve. But we're also going to have to work with our representatives to have new ways of scheduling, to do things a little more efficiently, and I'm confident we're going to accomplish that as well. But once we have the commitment to an excellent institution, we're going to fill those staffing spots. That's job number one.
You've already provided funding for additional staff, so what you're saying is it's time to, and I thought in fact for some of the classifications the pay had been raised.
Unfortunately, even though the legislature gave funding for additional staff, there just is a truth we have to recognize. At this hospital, up until now, we have not paid competitive salaries so that nurses' staff could get paid more in other institutions. That has to change so that we can fill these staffing spots. You cannot run this institution on the cheap and expect excellent quality care. So we are now going to evaluate what is necessary to fill these spots, to hire these nurses and psychiatrists, and when we hire them, people are going to get good care. I'm committed to that.
Okay.
Cheryl, how many do you need? How many staff?
The question was how many staff. Today, I think it's about 170.
Okay. And can you just explain with CMS being involved, how is that different than if you were just announcing a state plan in terms of this? What's the either the carrot or the stick or the help that they can provide?
I think what they do is they serve their regulatory function, which is to hold, as the governor says, holding feet to the fire and holding us accountable. But we do have a current corrective action plan from which we are working. And without this particular process, the systems improvement agreement, we would continue on that corrective action plan. I think it might be a little more difficult doing it under those circumstances.
All right. Thanks, you
I
guys.
want to add one more thing, because Austin usually asks great questions. Our state has learned an important fact in the last several months. If we want to have state troopers on the road, we've got to pay them competitive salaries. And we've improved those competitive salaries to keep good troopers on the road. And we have learned that if we want to fill these staffing spots at Western State Hospital, we need to pay competitive salaries. And we are going to start paying competitive salaries at this institution. And when we do that, and when we have the expected cooperation of our unions to have efficient staffing, quality is going to improve here. Safety is going to improve here. And we're going to meet our obligations to these patients. Thank you. Where are we going, Jamie?